And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.
Hey y'all, welcome to Keeping It 100. Y'all here, I don't have no voice. I don't know what is happening to my life this summer. I done kept my family confined for 2.5 years. I let these kids go to school and camp, and now I'm sick every week. Everybody else doing good. But anyway, we are here today, as always, to have these open and honest conversation with y'all to make sure you have the information you need to make good health decisions. I'm your host, Dr. Kristen Motley. And as always, we have a really good show in store for you. If you think of questions or have comments, just put them in the chat. And Dr. Tyan Thomas is behind the scenes. She'll make sure your questions are addressed and answered. She is going to look out for you. Now, this is when I would usually introduce my amazing co-host, George Mink Jr. I don't know where George is. George in them streets, y'all. He is saving lives. It's like, I don't know where he is, but he said he's going to hop on in a second. So we will catch up with him. I know he did an event over the weekend with Representative David DeLuca. So I wanted just to give him a shout out for holding a back to school event with the kids and having George there. Oh, hey, Georgie.
Hey, what's going on?
You good?
Yeah, I had to pull
you in
over.
Your mobile office?
Yeah, I had a meeting. I had a meeting at once, so I wanted to be here on time, and I thought I was going to be able to go in the place and set up, but I'm here though. What's going on?
That's what I'm talking about. Commitment to the cause.
Yeah, but it's all right. I'm sweating, but it's fine. But what you were talking about, Doc?
Now I was just talking about you and your event over the weekend. Do you want to talk about it a little bit?
Oh yeah, with DeLuso, right? State Rep Congressman DeLuso. Great event, community oriented. It was at Academy Park, actually where we're going to be on Thursday.
Okay.
Great guy. They basically dedicated to the cause. Met a lot of great families, took some good pictures. I sent them to you. Hopefully we got him on the show today. And he's a Delco resident and pretty good, Doc. So they actually supposed to be watching the show today. So what's going on if they watch?
Oh, shout out to the representative's office. Thanks for tuning in.
Right.
I know we have the pictures. She might be able to put them up for us in a minute. But that was a good event, and it looked like you did some really good engagement, talking to the kids. Which is what we really want, the parents. So good job on that.
Oh yeah, look at the guy. Yeah. What's going on?
That was cute.
Yeah, it was nice. It was very nice.
All right, so let's get caught up on COVID. COVID is still running these streets. I just want y'all to know. I was talking to somebody yesterday, and I was telling him that I had COVID a few weeks ago. He was like, "Really? COVID's still out here?" I was like, "Yo, will you stop playing? Stop playing." Yes, COVID is out here, and COVID ain't going nowhere. So just want people to notice, stay protected. The best protection is to get the vaccine. And I understand it's not an easy decision to make, but we have to learn about getting past our feelings and making decisions based on real information and not just how we feel. Use how we feel, of course, but accompany that with real information and then make decisions. And we've been talking about that for a couple of weeks. I was also talking to somebody at work. She said she was having a headache. She was having a sore throat. She had a light fever, cough. She had body aches, all this. And I was like, if you don't go get tested, she was like, I just got a cold. I was like,
right. Okay.
You got to go get tested. So she ended up getting tested. Her COVID test came back negative, which was great, but she had pneumonia, which is not good. So, like when these things are happening, we gotta stay on top of our health. We gotta take care of ourselves. And whenever you have a cold symptom, yes, it could be cold, it could be allergies, but you need to get tested because the worst thing you can do is be out here with COVID and spreading it to people who may not be vaccinated. And you're
Right.
putting them and their families at risk. So no, you may not want to get tested because you don't think it's COVID, but COVID looks like a cold. So you need to get tested to make sure you're not spreading it to other people.
Mm-hmm.
So just wanted to remind people COVID is still out here. We still have vaccine. That is the thing that prevents you from going to the hospital, from dying. There's going to be a new vaccine coming out in the fall that's going to specifically protect against the Omicron variant, which is going to be a big deal. I think we're going to see a lot less sickness with COVID. I'm hoping. I mean, that's the hope, is that we see a lot of sickness go down from COVID once the new booster becomes available.
Mm-hmm.
But today we are talking monkeypox. This is our first monkeypox show. I've been wanting to do one for a while, but I had to educate myself before I could start talking to y'all about it. And I had to find I wanted to find a guest to come on to help move this conversation along too. So I'm really, really excited to bring in Sebrina Tate, who's the Executive Director of Bebashi. And if you're not familiar with Bebashi, it's in Philly. It's at 12th and Spring Garden, and they provide healthcare services, health education, social services. I found out they have a food pantry, like all kind of support. And guess what they out here for, y'all? Black and brown people. They don't get no better than that. So, Sebrina, thank you so much for coming on the show today.
Thank you for having me. I'm excited to be here.
Thank you. Before we get started with our full monkeypox conversation, I just want to set the stage so that people can understand how we got here. I know that when COVID first started, people were saying it was man-made, that they were trying to depopulate and blah, blah, blah. So there's no evidence that COVID was man-made. I don't know about the depopulation. I haven't looked into that. But I want to make sure that we're like talking from the facts in terms of monkeypox. So monkeypox is not new. It was first discovered in monkeys in the late 1950s by researchers in Africa. And so at that time, they knew that it was a disease that could spread between animals. And it stayed between animals like rats and mice, squirrels. And it wasn't a problem in humans. Then in the 1970s, they found out that they saw that children were getting monkeypox. And this was happening because the children in West and Central Africa were playing or coming in contact with the wild animals. And so that's how they were getting it. It never became a big, widespread thing, causing a lot of disease and death. It just stayed, contained. I don't know if any children died from it. It's not a very lethal disease. It's just more like annoying and irritating for the most part. So that was in the 1970s. There is, and then I also want to throw in smallpox. So smallpox is related to monkeypox. They're like cousins. They're part of the same type of pox viruses. People were vaccinated against smallpox, and because of that, smallpox was eradicated in the early 80s. So smallpox went away in the early 80s because of vaccination. So this is proof vaccines work. They are not going to hurt us. They are here to help us. So because smallpox went away, we stopped vaccinating against smallpox. So there's some belief that if you have had the smallpox vaccine,
Stop. What's going on? You all right?
I'm talking too much.
Dog having a
All right, y'all. All right. I'm back. Okay. I'm ready. So if you had the smallpox vaccine, you might have some protection against the monkeypox vaccine. They're still looking at that. But in 2017, a researcher in Nigeria saw that men in their 20s and 30s were coming up with monkeypox, and it didn't make sense because they weren't playing with animals. Like, they weren't small children playing with animals. And when he did some more research, he found out that these were men who were mostly like sex workers or having sex with other men. And because they saw that the lesions from the monkeypox was happening in the genital area, and that let you know how it was being transmitted. This happened back in 2017. This infectious disease doctor in Nigeria tried to warn public health officials from all over the world that this was a thing that was new, that was happening. We need to keep an eye on this. Nobody wanted to listen to him. And here we are today with monkeypox spreading all over the world, with the United States having more cases than any other country in the world. So this is a whole real thing. It took time to get to where we are today, but here we are. And so I just wanted to set the stage with that, and now we're going to talk about it a little bit. Miss Sebrina, who's at risk of having monkeypox?
So we all are, honestly. I mean, everybody. If you touch human beings, which is a part of being a human being, having human interaction, then you are at risk of contracting monkeypox. But according to the health officials and the information that they're releasing to us, people who are most at risk are people who are exposed to people who they see have lesions, have fever, and have some of those symptoms that are related to monkeypox. We know that it's contracted by touch. So if I have monkeypox and I touch you and I touch a pock or something that is seeping from your skin, then it is likely that I'm going to contract monkeypox.
So it's transmitted through touch. George, go ahead, George.
No, I mean, it's just I'm just like in a wild moment. So is it compared to like chickenpox? Like, is it contagious like chickenpox?
It's like chickenpox. It's in the
Okay.
pox family, just like smallpox and
Right.
chickenpox. Monkeypox is very similar. It has some of the same. It shows up in the same ways. You have some of the same symptoms, and it's just that it's new, and people haven't heard of it. And like Doc said, it in most cases is not lethal. There's a small percentage of people who it is lethal for. And with anything, it's typically people who have other underlying medical conditions. But it is irritating and it can be painful. And it is extremely infectious. So it's something that we want to avoid spreading.
Right.
So this is a good time. We have a question from the streets. Can we play the video?
Monkeypox. What should I do to prevent it for myself and my family getting it?
So prevention, Miss Tate, what are your tips on preventing monkeypox transmissions?
So to avoid people who have any lesions, you want to be cognizant of who you're touching and where you're touching them, and you want to be sure that you're not touching anyone who has any rash, lesions, any open sores. And just like with COVID, you want to sanitize your space, your hands. You want to make sure that you're protecting yourself from just anything that you could get from a surface, because with any fluids from your body, you can transmit monkeypox and COVID and other infectious diseases, things like colds. So you want to make sure that you sanitize areas. For those who are most at risk, you want to make sure that you get the vaccine. There are not a lot of places that have the vaccine, but if you are a person who is having sex with someone who has lesions, anonymous sex, or has multiple sex partners, you want to make sure that you sign up to get the vaccination.
I was reading about this and the term anonymous sex came up. Can you talk about that? And I didn't get a chance to look that up, and I'm glad you mentioned it.
So I will say that, what the statistics have shown is that the people who are being tested as positive for monkeypox are typically MSM, or men who sleep with men, which means that it is being transmitted sexually. So when they say anonymous, that means that it is not a regular or monogamous relationship that you're having sex in. It means, for sex workers, for people who go to group sex parties.
Okay.
It means people who are having sex with people that they don't know who they're having sex with. If you don't know their name, you don't know where they live, and you're not inspecting their private areas thoroughly, if you are having random and anonymous sex, then you are at risk.
I see. So I know that there is a vaccine available, and the recommendation is to get it within 4 days of exposure. If you can get vaccinated within 4 days of exposure, you have a really high chance of not getting monkeypox. However, if you could get it with like 4 to 14 days after exposure, you'll have a less severe form.
New text message from Fluff 121525262729.
But it'll be less severe. So we talked about the vaccine. I know that there have been some problems with some places getting vaccine and kind of making it available to people who needed it. It's really in low supply. Do you have any updates, or do you have any information on that?
I do. So we were one of those places. Obviously, we serve the Black and Brown community. We are LGBTQIA plus friendly. We are forward facing. We have a trans necessity closet. So we have a support group for people in transition. And so we are very close to folks who may do sex work, who may have anonymous sex. People come here to get tested for STIs, and we're a trusted source. We look, we live, and we are very close to the people that we serve. And so initially when the vaccine came out, we were like, okay, well, we're ready. And we were asked if we were able to give the vaccine, and we said, certainly so. But we were not provided with the vaccine. We got the vaccine on Tuesday, yesterday, and we have a vaccine clinic. Yes, we have a clinic on Thursday here at Bebashi. We are asking people to call and register first. But I will say that supplies won't last. People are really, really afraid. And part of what has been a concern is who's getting vaccinated. And what we're finding is that the people who are most at risk are not the people who are being vaccinated. Which is also an issue. Yeah. So, I had this conversation with you, Doc, about, health disparities and why they exist. And a large part of why they exist is because of accessibility. One is accessibility, the other is information. So initially when monkeypox started to rise, the cases started to rise, and they said the people who are at risk are MSM, highest risk, because of how it's being contracted, right? There wasn't much information being given to the folks that I serve. And there wasn't much information given to us, because we were like, okay, so what does that mean? Does it mean it's sexually transmitted? Does it mean that it's only people who are having sex? In fact, that's not the case. And that's also the reason why we probably see the heightened numbers that we do in the cases that are positive, because who's to say that everybody that's presenting with some sort of lesion or fever is actually being tested for monkeypox when they have this lens of seeing it from, you got to be MSM. It's got to be in the genital area. That is a myth. So now that we have the vaccination, and I'm so glad that we do, we also find that a lot of people who are calling to make appointments do not identify as Black or Latinx.
Wow.
And when we wonder why is that the case, if those are the people who are coming up positive, right? We're afraid.
Yeah.
We are afraid. We're like, another thing. I don't want the government to put anything else in me. Yeah. And I'm saying to the people that I come in contact with, do the research, read about it. No, it is not lethal, but who wants to be quarantined for 4 weeks?
Wow.
Who wants to? Yes.
I didn't know the quarantine was 4 weeks. Wow.
The quarantine is as long as the pox.
You have those lesions. Yeah.
Yes. So it could be as short as 2 weeks or as long as 4. It's not, I don't know if you guys had the monkeypox, but when I was coming up.
Oh, chickenpox?
The chickenpox. Did I say monkeypox? I meant the chickenpox. I meant the chickenpox.
Okay.
The chicken pox, you had it for some time.
We did.
It doesn't just go away. It is irritating. It is painful. And it is extremely contagious. So you're not just quarantining because you're sick and you need to take care of yourself, but because you want to avoid giving it to others.
Absolutely. Yeah. Absolutely. So I'm glad to hear that you all have the vaccine. That's super important. And it's interesting for you to say that the people that are calling Bebashi to get the vaccine are not your primary target. So we got to stop letting people get in front of us. We got to take care of ourselves. Bebashi is there for us. We have to be at the beginning of the line, or else everybody going to get our resources.
Yeah.
We can't let everybody take our resources. So we have to educate ourselves. We have to make sure we're talking to people who we trust, who we know, and not believing everything you read on the internet. I would say believe nothing you read on the internet. Talk to people and get your questions answered. Because when you're reading information, you don't have anyone to rebuttal, and you can't say, well, that doesn't make sense. How does this? Why is that? You just have to just read it, and you can't have a discussion about it. Talk to people and make it make sense to you, and then get on to making a decision. Because anybody could put anything online. People are causing a lot of confusion, and they are trying to disrupt our lives, and we are letting them do it. And we have to stop. We saw smallpox was eradicated because of vaccination. Vaccines work. A lot of people missed their vaccinations because of COVID. So the vaccination rates in children right now are incredibly low. And we're going to see cases of polio and measles and chickenpox probably start to climb back up because we got to get these kids vaccinated. So if you miss your appointment for your children's vaccines, get them booked and get them caught up. It's never too late. It's never too late to get caught up on a vaccine schedule. I just want to give a shout out to
I'm sorry. I was saying the other thing is, sometimes we make decisions based on how we feel.
Yes.
Right. Just us as an individual, but that's a selfish approach.
Yeah.
It's a selfish approach to be like, well, I don't sit in this seat, so I'm just not going to. But you got to think about the other people you're protecting. If you know that you're a person who likes to have, anonymous sex, no judgment. You do what you need to do, but make sure that you're safe and you're keeping other people safe too. If you know that you're a person who loves to be in contact with people in large masses, that you want to make sure that you protect yourself, be aware of who you're touching and how you're touching them. And if they're okay, if they appear ill, not just because of monkeypox, but because of COVID.
Right.
Exactly.
Wow. So, Ms. Taylor, I got a quick question. Why do you think that it's coming at us right now? What's your reasoning for the now factor? Because it already was going on, it already existed. They even already had a vaccine, but we didn't start hearing about it or seeing it until they start showing us those vulgar pictures with the bumps, and it's just so what's your opinion on why that is just starting to happen saying it right now?
I honestly, I don't know. Personally, I have spiritual, reasonings behind why things happen when they do. I think all of this is, comes from.
I can relate. Okay.
But I'm with Doc on, us not being vaccinated and having herd immunity. These things rise because people were not being vaccinated in the way that they should have in the past. And then you see a resurfacing of these things. This has been around. The vaccine that we're getting is coming from a vault. This is not new vaccination. This is old vaccination that we're giving to people, and we're giving limited amount. This vaccination, like COVID, is two parts. We can only get one part of the vaccination. And I'm told that it should be sufficient. I hope it's sufficient because we want to give it to as many people as we possibly can to avoid this thing spreading any faster. We also know that it's going to take time for production if we find that it needs to happen. And I think that's what the call is for there to be some production in this manner. But honestly, this is burning out. This is burning out the healthcare field. Healthcare professionals are like, you know what? this vaccine we can't give to our providers. We cannot. It doesn't matter that they're testing for it. Doesn't matter that they're vaccinating for it. They cannot take the vaccination. They cannot have it, even though they put themselves at risk. We as workers, we can't get it. We can't get it. We have a list of criteria that you have to meet in order to get this vaccination. So that being said, like COVID, I'm really proud of the staff that work here, because with HIV, when nobody wanted to touch us, with COVID, when nobody wanted to stay open, we are here. We have been open every day. And without vaccination, we come to work and we provide the service. We do the best we can with the PPE that we have, and we give as much information as we can in order for us to remain safe and provide a safe environment for the people who come here.
That's good. And I think you brought up a lot of good points. One is that the doses are limited. So the regular schedule for this vaccine is that you would get 2 doses. I think it's 4 weeks apart, 3 or 4 weeks apart.
Similar to COVID.
Yeah. But because there's not enough doses for everyone that needs it, people can only get 1 dose right now, so that we can vaccinate as many people as possible. It's because there's not enough doses right now. And so that's why the healthcare workers can't get it. If the healthcare workers don't qualify like a regular patient would, they can't get it, because then you're taking it away from a patient who is at high risk of getting COVID. And Ms. Tate, can you talk about that a little bit? Who is eligible to get the vaccine?
So there are a list of screener questions, and one of them is the one that we asked, that we talked about earlier. If you've had anonymous sex in the last 90 days, if you have had group sex in the last 90 days, if you have multiple partners, if you've been identified as having an STI or a sexually transmitted infection in the last 90 days, if you are MSM, these are the questions that they're asking or if you've been around someone who has been diagnosed with monkeypox. These are the questions that they're asking to say, are you at risk? Do you qualify? Are you one of the people that we want to give these limited doses to?
Okay, thanks. So you have to meet those criteria. And if you meet those criteria, that's when you can potentially get the vaccine.
Yes.
Now, are you offering testing too in your office?
Yes, we test every day.
Okay.
We don't vaccinate every day, but we do test every day, and we give treatment.
Okay, good. And I want to bring up this too, is that you can only get tested for it if you have a lesion. So there's like specific stages to the disease where it starts off where you don't have any symptoms at all. And then you may develop a fever, the chills, cold and flu-like symptoms. And then the next stage happens where you develop the lesions. You can't get tested until you develop the lesions, because it's the lesions that they test to see if that's a monkeypox or not. So it's important to know that. It's important to look at your body, see what's going on, and to know what's normal and what's not normal. And if you have any new or unexplained rash, then you may want to consider getting tested, especially if you're in that high risk category. So I wanted to ask if anyone did want to get tested or do need to know where they could get the vaccine. Can you share contact information with Bebashi?
Yes, Bebashi Transition to Hope is at 1235 Spring Garden Street in Philadelphia. Our hours for vaccination will be Thursday from 4 to 7. But our clinic hours are basically 9 to 5, Monday through Friday, so you can get tested at any time. If you are interested in signing up to be vaccinated, you can call our main number, 215-769-3561. Yep. And we do COVID testing also. We do STI screening. Of course, we test for HIV. We have a pantry of choice. So if people need food, they can come and visit our pantry. Yep, we have an array of services that we provide to the community.
That is awesome. I love it. I love it. And so a lot of our listeners are from Chester or from other areas of Delaware County. And I did reach out to the county health department to find out where was testing and vaccines available. I haven't heard back yet, but I will let y'all know when I have an update. I know on the website, They said you can go to your healthcare provider or to an urgent care center. I'm just not sure to the extent that they are providing testing and, just regular PCP offices. I'm not sure to the extent that they're providing testing or vaccines. I did reach out to Chest Pen. Chest Pen is not providing any vaccines at this time. I don't know if that will change later, but I'll keep an eye on it and I'll let y'all know if there's anything changing about that. But I think the most important thing is the same thing with COVID is to get tested. Like get tested because it's you knowing that you have it that will help prevent you from spreading it to other people. And again, this is like a public health thing. This is not like an individual Christian's health thing. This is a public health thing. Like you do it for people that you love, people that's around you, people that's in your household, your community, your neighborhood. So if you get tested, then you'll know if you have it or not, and then you can take actions to limit the spread. Getting a vaccine is a whole nother choice. You can choose not to get it, or you can choose to get it. Just know that the vaccine is there to help prevent you from having severe disease. So it's just a choice, but just know your choices and know your rights, so that you can make a decision that'll be most helpful for you.
I was reading a comment that came in, and I'm sorry I missed your name on the comment, but I wanted to address it. We do not get paid to give the vaccination. We do not. What we do is we provide people with the opportunity. I'm going to give you the same opportunity that everyone else has, whether you are Black, Latinx, white, whatever. What I do know is this has been available in other populations. They've had access to this vaccination. And Bebashi wanted to say that we want to be able to give that choice to our people. Whether they choose to do it or not choose to do it is on them. We certainly aren't pushing it. We don't get paid for it. But we want to give them the same options that others have.
Yeah, it's true. I mean, I'm not even getting paid to do the show. I'm doing it because I just want to get the information out here to people so that people can't say, no one told me. You can come on and you can listen or you can not. So I don't have any financial benefit in any of this community volunteer work. I just want to make sure my people have the information to get, to make their own health decisions. I still question about how many people had got vaccinated and boosted and still got the disease. Me, that's a lot of them. And that just goes back to, COVID vaccine. One more. COVID vaccine was designed to prevent us from dying and going to the hospital. It wasn't designed to keep us from getting COVID or getting sick. So it has done that. The people that are vaccinated and boosted, it has kept us out of the hospital. It's kept us from dying. And that's what we expected the vaccine to do. We didn't expect it to do anything above that. And so I'm pleased with the results that I've been seeing from people who have been vaccinated and who have been boosted.
Yeah, the same with monkeypox. I mean, if you are not a person who is in constant contact with others, touching people, I wouldn't suggest that you just sign up to get a vaccination. But if you're a person who is having multiple sex partners, if you're a person who is in contact with the public, I mean physical contact with the public in large numbers, and you feel like you're at risk, you're around people who have had it, then I would suggest getting the vaccination. But again, that's how I see things. It's from what I've read. That was my suggestion. But we make it available for people who want it, and for people who don't, they don't have to.
Yeah, absolutely. It's about making your own decision and your own choice. George, did you want to say something?
Can people die from this?
They can. Yeah. People can die from monkeypox. It's rare.
It's really rare. Yeah,
it's rare, but it can happen. And the thing that we found with the thing that we're finding is we don't have a whole lot of information about this. Just like COVID, initially it's like, oh, can you die from COVID? There were people who were dying from COVID, because they had underlying health conditions that they didn't know they had.
Right.
They didn't
Right.
even know that they were sick. They didn't know they had something else going on, and this exacerbated it. So again, you have to assess your own risk and say, can I do, do I know myself to be strong enough to withstand something taking over my system and not being able to fight off other things that are happening at the same time,
Right. Right.
And
Right.
am I the type of person who is able to be at home for 3 to 4 weeks to keep other people from getting? Yeah. Because I personally have to work every day. I need to come in here every day. Most of us can't afford that.
Yep.
Right.
I do want to say that I know as of last week, I believe it was about 14,000 cases.
Text message from Mrs. Mink.
14,000 cases of monkeypox in the world, and they only reported 5 deaths. So death is very, very, very rare. It's not common, and I'm sure, just like Ms. Tate said, it has to do with what other underlying conditions you have and what other complications can come up. So it is very rare. So this is not a vaccine that you get to prevent yourself from dying, like in COVID. This is to prevent yourself from having the painful lesions, from having to be out of work for months, for weeks. So it's just to keep your quality of life, to maintain your quality of life,
and to prevent spreading it to others.
Yes, yeah. So that is the only other questions that I had. I wanted to give you another opportunity, Ms. Tate, to share contact information for Bebashi.
Yes. So obviously you can always look on our website, bebashi.org, or you can come to our site, 1235 Spring Garden Street in Philadelphia. And if you are interested in any of our services, you can call us at 215-769-3561.
Thank you so much for coming on, at short notice.
Right. I think we're going to have to bring her back on, Doc.
Absolutely.
Because I'm going to probably have some more questions for you next week.
We'll have updates as to where we are with giving out the vaccination and getting more, because now it's a race for who gets more, who gets what, when. Again, if we're the people who are getting monkeypox and we're the people that need to be vaccinated, then I say you should start with providing the vaccinations where it's needed.
Right.
Absolutely. Wow. So on that, we are going to sign out. Thank you so much for coming. Thanks everybody for tolerating my coughing and my voice. I didn't want to cancel.
Feel better.
I just didn't want to cancel. I was like, we said we're going to do this show. We're going to do it. And we did it. So thanks for tuning in. Shout out to Rick and Miss Simpkins for checking us out today. And to King, thanks for all your questions and comments on YouTube. We see you over there. Everybody have a good day. We'll see y'all next week.
All right. And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction, how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?